Navigating the healthcare system can be a daunting experience, especially when faced with complex medical decisions that impact your well-being. From choosing treatments to trusting your healthcare providers, the decisions you make are critical, and the choices presented to you can often feel overwhelming. Yet, at the heart of these decisions lies your agency, your ability to actively participate in your own care, informed by your personal values, medical advice, and trust in the healthcare system. In today's healthcare landscape, there are several factors that shape how decisions are made. While medical expertise and institutional guidelines play a crucial role in ensuring that you receive the best care possible, your autonomy, your right to make choices about your treatment, remains central to the process. At the same time, the rise of technological advancements and the increasing influence of financial pressures add layers of complexity, affecting how care is delivered and which options are available to you. This article breaks down these intertwined elements by exploring three critical triads in healthcare decision-making: patient autonomy, medical expertise, and trust, institutional guidelines, financial incentives and ethical integrity, and technological advancements, risk tolerance and quality of life. Each triad reflects a set of interrelated factors that influence how healthcare decisions are made, and understanding them can help you better navigate your own care. The goal is to help you see how these factors work together, showing you where and how your voice matters in the process. By understanding these dynamics, you can better advocate for your needs, ask the right questions, and make more informed decisions. Ultimately, the power to influence your healthcare journey lies in your ability to engage confidently, equipped with knowledge, and supported by a system that respects your autonomy while providing expert care. In modern healthcare, one of the most significant challenges is balancing patient autonomy with medical expertise while maintaining trust. Patients, increasingly informed and empowered, seek to take control of their healthcare decisions, advocating for treatments that align with their personal values, beliefs, and understanding. However, these choices must be informed by accurate and comprehensive medical knowledge, something physicians are trained to provide. The relationship between the doctor's expertise and the patient's autonomy is nuanced and delicate, often hinging on the strength of interpersonal trust. Trust, in turn, is built on the physician's ability to communicate clearly, demonstrate competence, and respect the patient's values. Key challenges include patients feeling overwhelmed by medical jargon, or doctors struggling to reconcile a patient's wishes with what they deem medically necessary. Furthermore, systemic pressures such as time constraints in consultations and fragmented care from different providers can erode trust. For patient-centered care to succeed, autonomy, expertise, and trust must be seamlessly integrated, ensuring that patients are active participants in their care without undermining the expertise of their medical providers. Patients' ability to give informed consent is heavily influenced by the physician's capacity to convey accurate, evidence-based medical information. A patient with incomplete or misunderstood information may lose autonomy due to a lack of clear understanding of their medical choices. A patient's health literacy is enhanced by effective communication. Physicians who communicate in a patient-centered, empathetic manner help build trust and improve the patient's ability to make autonomous decisions. Clear and respectful communication fosters confidence and trust in medical recommendations. Trust is influenced by the patient's past experiences with accurate diagnoses or misdiagnoses. Diagnostic precision strengthens trust over time, while repeated diagnostic errors can erode it. This interaction reinforces the importance of both technical skill and long-term relationships in building trust. A key insight here is the circular reinforcement between patient autonomy, medical expertise, and trust. Physicians who excel in diagnostic precision and clinical communication empower patients, which in turn fosters trust. This highlights that building trust is not solely about the physician's technical skills, but also about ensuring patients are active, informed participants in their care. The delicate balance between patient autonomy, medical expertise, and trust reveals the importance of an integrated, patient-centered approach to healthcare. Autonomy cannot truly be realized unless patients are equipped with the knowledge to make informed decisions. Yet this knowledge must be conveyed with compassion and clarity by medical professionals who are trusted as experts. The interaction between these elements shows that empowering patients with clear, accessible information fosters deeper trust and respect for medical expertise. However, One of the key challenges in this triad is that patients often struggle to understand complex medical information, while physicians may lack the tools or time to explain procedures in a way that respects patient autonomy. When there is a breakdown in communication, trust falters, and the decision-making process becomes less collaborative. To enhance this dynamic, healthcare systems need to place a stronger emphasis on health literacy, ensuring that patients are better educated and more confident in their ability to engage in conversations about their care. Shared decision-making can be strengthened by using decision aids that present treatment options in a clear and balanced manner, helping patients weigh the pros and cons in collaboration with their doctors. Additionally, continuity of care, where patients regularly interact with the same healthcare provider, helps to build long-term trust, allowing for more fluid and effective decision-making over time. In essence, when patient autonomy is supported by clear communication and expertise is delivered with empathy, trust becomes the glue that holds the entire relationship together, leading to improved outcomes for all involved. Navigating the complex landscape of institutional guidelines, financial incentives, and ethical integrity is a major challenge in healthcare systems worldwide. Healthcare institutions establish guidelines to standardize care and ensure safety based on the latest clinical research. However, these guidelines may not always account for individual patient needs or emergent scientific discoveries, creating tension between standardization and personalization. In parallel, the economics of healthcare, whether through profit-driven incentives or cost-saving measures, can influence clinical decisions, sometimes prioritizing financial efficiency over patient welfare. Physicians and healthcare providers, caught in this complex web, must uphold their ethical integrity, ensuring that patient care decisions are based on the principles of beneficence and non-maleficence, rather than financial gain or institutional mandates. The challenge here lies in managing the friction between institutional pressure for uniformity and efficiency and the ethical obligation to provide individualized, compassionate care. Ethical dilemmas arise when financial motivations conflict with clinical best practices, leading to moral distress among healthcare providers and potentially compromised patient outcomes. To mitigate these issues, a balance must be found that aligns institutional guidelines, ethical principles, and financial realities in a way that supports both sustainable healthcare and patient-centered care. While institutional guidelines are designed to ensure the best standard of care, financial incentives may push providers to prioritize volume over individual patient needs. This tension between protocol adherence and profit motives can create conflicts where what is financially incentivized may not always align with patient-centered care. Institutions might implement cost-saving measures that undermine the ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. Ethical integrity can be compromised when financial incentives push towards the denial of beneficial treatments to save costs. The lag between new research and guideline updates can cause moral distress among healthcare providers. When outdated protocols force physicians to adhere to practices that are no longer deemed optimal, they may experience ethical tension, feeling they are unable to provide the best possible care. The institutionalization of care creates a delicate balance between financial and ethical pressures. Profit motives often challenge the ethical frameworks that guide clinical decision-making, leading to potential moral distress. This triad emphasizes the importance of ongoing policy evolution and the need for ethical checks on financial incentives to ensure patient welfare is prioritized. At the intersection of institutional guidelines, financial incentives, and ethical integrity lies a complex web of influences that often pulls healthcare providers in conflicting directions. Guidelines are designed to standardize care and ensure best practices, but they may not always account for individual patient needs, leading to friction between the push for uniformity and the demand for personalized care. At the same time, financial pressures, whether from cost-saving measures or profit-driven incentives, can shape clinical decisions in ways that may conflict with ethical obligations to prioritize patient well-being. This triad highlights a fundamental tension in modern healthcare: how to reconcile economic realities and standardized care protocols with the ethical duty to act in the best interest of each individual patient. For instance, a physician might face moral distress when institutional guidelines and financial constraints force them to offer less than ideal treatment options, even when better alternatives are available but not financially feasible. To mitigate these tensions, Healthcare institutions should strive for policy flexibility that allows for more personalized care within the framework of established guidelines. By regularly updating institutional protocols to reflect the latest medical evidence and patient needs, and by creating reimbursement models that incentivize high-quality, ethical care rather than sheer procedural volume, it is possible to align financial motivations with ethical principles. Furthermore, fostering a culture of ethical support for healthcare professionals through ethics committees or regular ethical training can help providers navigate these challenges without compromising their integrity. Ultimately, maintaining ethical integrity in the face of financial and institutional pressures requires a conscious effort to ensure that the patient's best interest remains at the heart of all decisions. Balancing these competing forces requires a flexible, ethically grounded approach that respects both the economic realities of healthcare and the individuality of each patient. As technological advancements revolutionize healthcare, they introduce new challenges in balancing risk tolerance and quality of life. Emerging technologies, such as precision medicine, AI-assisted diagnostics, and minimally invasive procedures, have the potential to significantly improve patient outcomes by offering more personalized and less invasive treatment options. However, these innovations often come with substantial risks, both financial and medical, that patients and physicians must carefully weigh. For some, the promise of cutting-edge treatments represents hope for improved survival or recovery, but for others, the associated risks may be too high, particularly when weighed against potential impacts on long-term quality of life. One key challenge is the disparity in access to advanced technologies, which may only be available to certain populations due to cost or geographic limitations. Additionally, both patients and providers must navigate the uncertainties associated with newer treatments, where long-term effects are often unknown. Physicians must consider not only clinical outcomes, but also the patient's personal definition of a meaningful life, making decisions that balance technological potential with a patient's tolerance for risk and desire for improved quality of life. Personalized high-tech treatments, for example genetic therapies, often present new risk-reward paradigms. Some patients are willing to accept the risks of cutting-edge treatments for a potential cure, while others may be more risk-averse, preferring established therapies even if less effective. The availability and cost of these advancements also influence their accessibility, complicating patients' decisions about risk. Minimally invasive procedures are designed to reduce recovery time and improve functional independence, which enhances quality of life. However, access to such procedures may be limited by cost, insurance coverage, or institutional capabilities, meaning that not all patients benefit equally from these advancements. Regulatory bodies that evaluate the safety of new technologies must balance short-term survival outcomes with the long-term impacts on a patient's quality of life. What may be acceptable in terms of risk in the short run may not align with long-term goals for patient well-being. The interplay between technology, risk, and quality of life underscores the need for personalized care. Technological advancements offer transformative benefits but come with inherent risks and financial barriers. Decision-making must therefore incorporate patient-specific perspectives on risk tolerance, ensuring that treatments align with their long-term quality of life aspirations. The rapidly evolving world of technological advancements in healthcare brings both tremendous opportunities and significant challenges, particularly when considered alongside risk tolerance and quality of life. New technologies, such as precision medicine, AI-driven diagnostics, and minimally invasive procedures, offer the promise of more effective, personalized care. Yet, they also introduce new uncertainties, as both physicians and patients must navigate the risks that come with adopting cutting-edge treatments, often without fully understanding the long-term outcomes. This triad reveals a key lesson about the need for careful risk-benefit analysis in medical decision-making. While some patients are willing to embrace new technologies despite the risks, others prioritize comfort and quality of life over experimental or aggressive treatments. Physicians, too, must balance their knowledge of emerging technologies with their ethical responsibility to prioritize the patient's overall well-being, including long-term functional independence and emotional health. To improve the balance within this triad, healthcare systems should focus on enhanced communication about risks, ensuring that patients are fully aware of the potential consequences of new technologies. This can be achieved by creating risk tolerance profiles for patients, helping to guide conversations about what treatments are appropriate based on each individual's values and expectations. At the same time, regulatory oversight must evolve to keep pace with technological advancements, ensuring that new procedures and devices are rigorously tested for both short and long-term impacts on quality of life. In conclusion, as technology continues to transform healthcare, it is crucial that the adoption of new tools and treatments is tempered by a deep understanding of patient values and a commitment to improving their quality of life. By aligning technological innovation with thoughtful, patient-centered care, the healthcare system can ensure that advancements lead to not just longer lives, but better ones. By examining the interactions within and across these triads, we can extract several lessons. Holistic decision-making. Healthcare decisions are rarely isolated. Factors such as financial incentives, institutional guidelines, and ethical principles interact dynamically, shaping patient outcomes in complex ways. A systemic approach is necessary to navigate these multifaceted relationships, ensuring that patient welfare remains the central focus. Dynamic tensions. Conflicts between standardized guidelines, individualized care, and economic pressures highlight the need for adaptable healthcare systems. These tensions require careful balancing, particularly in fast-evolving fields where technological advancements constantly reshape the landscape. Interdependency of trust and expertise. Trust between patients and providers is deeply intertwined with both communication and technical expertise. Transparent, patient-centered communication can overcome many barriers to trust, especially when combined with diagnostic accuracy and ethical integrity. What these triads reveal is that healthcare is more than just a series of clinical decisions made on your behalf. It's a collaborative process where your voice and preferences should be central to the outcome. As we've explored throughout this piece, the interaction between patient autonomy, medical expertise, and trust forms the foundation of effective healthcare, empowering you to make informed decisions about your care. When you understand the institutional guidelines and financial incentives that influence the system, you become better equipped to advocate for your needs in a way that aligns with both ethical integrity and your personal values. Similarly, recognizing how technological advancements impact risk tolerance and quality of life enables you to make more nuanced choices about the treatments you pursue. The key lesson is that your agency matters. Your preferences, informed by your understanding of the medical landscape, should drive the care you receive. By taking an active role, asking informed questions, and building a trusting relationship with your healthcare providers, you can navigate the complexities of the system with greater confidence and clarity. Whether facing a routine checkup or a life-altering decision, the power to influence your healthcare journey ultimately lies within you. Moving forward, the best path to optimal healthcare involves fostering open communication, understanding how various factors influence the system, and always keeping your well-being and values at the forefront. With knowledge, trust, and collaboration, you can make choices that not only extend your life, but improve the quality of it, empowering you to take control of your health with assurance and clarity.